Hi, my name is Kalee E. I'm a senior at the University of Florida studying nutritional science on the pre-med track. I've been very influenced by the healthcare team that's led me to become the successful patient that I am. This year marks the fifth anniversary of me being diagnosed with Crohn's disease. It also marks the third year I've been a part of the National Council of College Leaders. We are a group of about 20 college students from all across the country who represent patients, especially college age students, with IBD. Today, we'll be putting on a webinar outlining mental health and its relationship to IBD. I have a topic specialist, another council member joining me during this segment, and I'm going to let them introduce themselves.
Hi guys, I'm Colette Manley. I am currently a junior at Iowa State University studying animal science, hoping to go into veterinary school. I was diagnosed with ulcerative colitis at 13, which then changed to Crohn's disease when I was 17. And this is going to be my second year on the National Council of College Leaders. I am part of the education work group, and we're responsible for putting on this webinar. And I am also now going to be one of the co-chairs leading the group. So I'm very excited to be part of this.
And I'm Maggie Stoeckel. I'm a pediatric psychologist at Seattle Children's Hospital in Seattle, Washington. And I am embedded in our Department of Gastroenterology, and my specialty is in IBD. So I work with many of our kids and teenagers and families with IBD. And I love what I do because I meet so many great families every day. And this is my first time being a part of this webinar. So thanks for having me.
Well, thanks for joining us. I guess I'll go ahead and open this segment. We're going to focus on mental health and transitions, particularly in college age individuals with IBD. So I guess I'll start with asking Maggie how IBD can influence just a patient's mental health and emotional well-being.
Yeah, thanks, Kalee. So as you all probably know, having a chronic illness like IBD can affect you in many ways, and particularly during transitions. Kids and teenagers can be vulnerable to symptoms of depression and anxiety. And in my clinical experience, depression and anxiety symptoms can be a really normative part of illness-related distress for kids and teenagers with IBD. So specifically in terms of transitions, for example, from going from high school to college, teenagers may be worried about a lot of different things that will change when they start college life. For example, how to manage a flare in a new environment with new professionals and new people around them. Accessing medical care may be a concern, that need to find a new doctor and be comfortable with the healthcare system in potentially a new state. There may also be some concerns about how to handle schoolwork, because we know that college may involve an increased workload, and just how to balance that with managing IBD. There may be also a lot of different social relationships to adjust to, new hours. We know that college students typically stay up pretty late, and that may be a transition in and of itself and can pose some challenges for managing a chronic illness like IBD. And then also generally just settling into a new living space. Dorm life is very different from living at home with your family. So adjusting to that and knowing how to manage IBD when you have some new people around you. Depression is also another common component of illness-related distress, and is something that I talk to all of my patients about, because these kinds of symptoms can come up and down, um, just as IBD it can be up and down. So teenagers that are making that transition to college may feel isolated at times. They may feel helpless or overwhelmed in managing um, IBD, and particularly in that new environment. And so because of that vulnerability in making a transition, it's particularly important to be aware of the resources on a college campus and in a new city. And that's why I love what I do, is because I know that I can be a resource for patients as they make that potentially difficult transition to college. And yeah, that's the basic summary I'll give for now.
Colette, do you want to talk a little bit about how IBD has impacted you in terms of mental health and emotional health?
So yeah, when I was first diagnosed with IBD, I kind of swept it under the rug, but I think when I started transitioning to college. And, it was in my senior year, kind of getting ready for college was when I really noticed that IBD had an effect on me mentally and emotionally. I was really, really sick during that period, and the doctors were thinking about taking out my colon. Ended up didn't, because I got diagnosed with Crohn's disease instead, so we decided to keep that around. But it was then when I started feeling really isolated and really just ready to go off to college. So I actually had a pretty good transition going to Iowa State. It was a really positive experience. I made a lot of friends right away, and my dorm mates were really, really good about trying to understand what my IBD was and how it affected me, and just talking about it with people who didn't necessarily know what it was helped me cope with my disease and helped me understand it better than I thought I could. So I know I had a really good positive experience, and it's been great since then. Kalee, have you had the same experience as me?
Okay, that makes me happy you had a good transition. I had a very different journey as a patient. I was diagnosed my junior year of high school, and I came from a very small high school. We had a graduating class of less than 80 kids, and when I came to college, my first lecture hall sat more than 500 students. I was also put on a complete liquid diet by my healthcare team to put me into remission, which was successful, but unfortunately was very hard to socially cope with. And I think the CCFA support group in my area was really my saving grace. I now have been the facilitator of the Gainesville support group for about 2 years now. And they've been with me through my highs and lows, and has taught me a lot about my disease. I also think what contributed to my rough transition was the fact that I had finally received a diagnosis, but I had hit that 18-year mark, and I had to start the transition from pediatric to adult, which is something that brings a whole new set of responsibilities. So there are a lot of resources out there, but I don't think a lot of IBD patients fully realize that. I know another transition that I really struggled with is once you hit that 18 or 21-year mark, you also have to start the transition from pediatric to adult. So that brings a whole other set of responsibilities. But I know there are a lot of pediatric clinics out there that kind of help with that transition. Maggie, would you want to talk a little bit about some of the resources that can be provided to patients to help with that transition?
So Kalee, thanks for asking that, and for sharing your story. And Colette, thanks for sharing your story too, because I think it's just helpful to hear what your transitions were like to college, and you can see that they were pretty different. And there are so many resources out there, but they can be really hard to access if you're not sure. And that transition from pediatric to adult care can be really challenging. And that's why it's really great if you have mental health resources and social work or psychologists integrated into your division of gastroenterology, because that's what we're here for. We're here to help with that transition. The CCFA does a really awesome job of providing resources on the website related to transition. So that would be one of my first recommendations, would be to access that. And your gastroenterologist in a pediatric setting will help with that transition to adult care in many ways.
I definitely think the journey from high school to college is a tough one. One thing my pediatric gastroenterologist did a great job of doing was really facilitating with that transition. She basically wouldn't let me look over to my mom during appointments to ask, what medications I was on, how I was feeling. She really taught me and kind of forced me a little bit to be the best advocate that I could for myself. I got familiar with my health record, what medications I was on and why, and I learned how to manage my medications. I learned how to talk to my dietitian and figure out my nutrition without relying on my mom's help. And that really helped me gain the independence that I needed to go off and start my own journey as a college student. So Maggie, what other recommendations might you have for high school students and parents just to kind of facilitate the journey from high school to college?
So as we can all imagine, that transition from high school to college is really challenging for anyone, but particularly when you have a chronic illness like IBD to manage, it can be more complicated. So my biggest advice to the kids, teenagers, and families I work with is just to be prepared and look into things beforehand. So many college campuses have wellness centers and counseling centers. There's also community clinics. And I think it's really important to look into those resources and see if they have any providers that specialize in helping patients that have chronic illnesses, because it really is a different approach to treatment. So that would be my first suggestion. And then accessing all of the wonderful local support groups that CCFA has to offer can just really expand that network, and you can hear from other people in the area. So those would be my two biggest recommendations to the patients that I work with.